Our next speaker is Penny Jones, who's the Director of Integration and Partnerships at Southwestern Sydney LHD, and she's going to be talking about the Oran Park Story, creating and evaluating an integrated primary care centre. Thanks, Penny.
Good morning, welcome to day 3 and the last day of our APIC conference. So I'm here to talk to you about the Oran Park Story. So a little bit like the Coburn experience we were talking earlier, we didn't get a supercentre, and the main reason for that is that Oran Park is on the growth corridor. So people talk about the growth corridor, particularly in southwest Sydney, because there's an overall expectation that we'll have about a 5% growth. If you have a look at the numbers, this is just Oran Park. So between 2016 and 2021, we're growing by 11,000 people. Okay, so we're growing by 11,000 people. But if you actually look in a 10-kilometre radius, we've also got Oran Park growing in an insane rate. So we've already surpassed the 11,000 growth. And these are 4 suburbs. There's first 2 here and then another 2 here, with another 50,000 people coming into the region in the next 2 years. So Oran Park is growing really, really fast. So what we decided to do with Oran Park was, instead of waiting for the population to arrive, that we would build an integrated healthcare hub and have people use it from the beginning. So it's one of the first times that they put in something the size of Oran Park before the population actually existed. So they normally don't start any of these sort of integrated healthcare centres until we've got a population of 50,000. We've got a current population of about 11,000 in Oran Park, and we've already put in an integrated healthcare hub. We've found that to be really helpful to move the community, which is a particularly young community, into using an integrated healthcare system. So how this was done was they built a shopping centre. So Oran Park is a master planned suburb that will be developed into an integrated healthcare hub right across the services. There's talk about a private hospital going in. It's right in the centre of Liverpool, Campbelltown and Camden hospitals, so it's a 10-minute drive to any of those facilities for anybody who lives in this area. And as I said, it's on Camden Valley Way, and you drive down Camden Valley Way one day and you drive down the next day and there's 2 new suburbs that have popped up. They're moving in Oran Park an average of 30 families into brand new dwellings a week. The other place people hear about Oran Park is it has the primary school that had 22 demountable kindergarten classrooms this year because it exploded. They actually the government helped pay for some of the private schools to be built to take some pressure off. Its growth was unprecedented. From a health point of view, we've got an area of the ground floor of the shopping centre where we purpose-built a small super centre. So it's got the 4 consult rooms, it's got some allied health consult rooms, it's got 4 specialist suites, and it's got an area that was built for medical imaging that's now going to be a paediatric centre because we're putting medical imaging across the road because we grew too fast. When we were looking at Oran Park, we really wanted to look at what our integration values were. So we had the opportunity to build something from the get-go, and we were able to build it before the community arrived so we could work together to determine what we felt was needed. This was a community that was generally, the people that were moving in were generally dual working families with starting their family or new children, young children. So we wanted to make sure that we were providing the best care that we could in the best possible way that we could, and we didn't want to have people on the road all of the time. These are time-poor families. We wanted to make sure that they could access most of what they would need. And by using some of the key integration things like, we partnered with universities from the beginning. We looked at innovative practices. When we were tendering for GP practices, we ensured that they understood what we were moving towards and were willing to work with the LHD and the PHN every single day. And that's how we've been able to make it work. At the moment, we've got the LHD working in there, so we run wound clinics, hospital in the home clinics, child and family baby clinics out of the centre. We have pathology. We've got Karatani, which is a parenting service, and that was asked for by the community and delivered. And then we have My Health run the medical centre with the GPs. They also have, they run the allied health services that are provided as well. So we've got podiatry, nutritionists, physiotherapists, which are just exceptionally busy, OTs and speech pathologists are about to start, and a psychologist is just fitting out her room. The practice population is really interesting. So they've been running for 2 years now, and their population is 8,500 people, and about 90% of those come from the Oran Park, but they're definitely coming from the communities all around. In the 2 years that we've been open, 10 practices have gone up in the region, and our practice population is growing every single day. We're growing by about 350 patients a month at the moment. The practice population has like 12.8% under 4, hence the need for a paediatric clinic, and we're probably looking at a paediatric developmental clinic that we're going to pop into this area. They run to a regime of 15-minute appointments, so it follows all of the quality standards. They're seeing about 4,600 patients a month, and they're considered through the PHN's QRPC program as a Tier 3 beacon practice. So they've been able to, we actually have more GPs wanting to work at this practice than we physically have space for. So we're building across the road because patients are still coming in their droves. The interesting thing that we did though before we started was that we ensured that everybody who came into this practice as part of the tender arrangement agreed to a data sharing continuum, and all patients that sign into the practice are aware that we do data sharing between the LHD and the GP practice. So this has been used as a test bed in New South Wales for an integrated IT solution, which I'll talk about in a moment. But what we're doing at the moment in the evaluation centre is we're pulling the pen cap, but we've installed granite in as well, where we're bringing out the data from both patients that are in the practice and are using the LHD and matching them to get a true view of the journey and what are the conditions from that practice that are moving into the local health district for services, and is there anything that we can put in place that would reduce their hospital attendances, and able to have that linked data and data sharing agreements from the beginning has stopped some of those issues of, that's my data and I don't want to share it. Everybody is around the table. We de-identify the data, but we work to make sure that we have a lot of stringent data analysis going on all of the time, so that we're tracking these patients in this new community so that we can understand and build more centres like this. The governance partners, as I said, is the PHN, the LHD and Western Sydney University, and it's interesting that this model started in the PHN and then when they at the Medicare Local, and when they switched over, it was so well advanced that we were able just to switch the delivery partners to the LHD, and we all have stayed in the same roles. Western Sydney University are heavily involved both in attendance at meetings and in all of the research that we do. This was one of the ways in which we did it, and I don't expect people to be able to read this slide. The blue screens let you know that there's a lot of legally binding documents that we bring people in with on this. So if you come in as a partner into Oran Park, you're coming in, signing a contractual arrangement to share data, to work with our patients, and to be able to be a test bed to build more centres like this in the future. And then we have less formal documents around our shared policies and procedure drives. So you've got 5 agencies in there at the moment. They all have their own policy and procedure and draft guidelines. We don't want everybody to be singing from the same song sheet, but we all know everybody else's policies and procedures, and we have a register of them. So if Karitani was accredited just recently, they could be accredited using their processes within the bounds of Oran Park. So we make sure that everybody can still meet everything that they need to do for their own industry as well as part of the integrated healthcare hub. We've just finished our phase 1 research where we did some semi-structured interviews with clients, who are our most important person, and the stakeholders, so all of the different agencies, and we found lots of interesting things, and we often found that the two didn't match. So what the clients wanted and thought was important to upgrade or change was actually different to what the stakeholders thought that might be. Stakeholders were really concerned about their waiting room. It didn't come up in one single issue with the clients. They loved the fact that they could come to one centre and that they could get the services that they needed, and if they couldn't get them there, we were able to direct them to something very locally, and that really worked. The evaluation is moving into phase 2, where we've now got our baseline of information. We've moved in multiple more partners since that was done 12 months ago, and we're now going to run a second lot of stakeholder interviews. And interestingly, there's a lot of other research that runs out of this practice. So the Watch Me Grow app, because of the young population, is run out of there as well. What we're moving towards is the integrated health neighbourhood. So as I said, I've used the terminology test bed, and we mean it in this space. So we are testing what is working, what is not working for our community in these new areas. We have 5 suburbs that are about to explode across the southwest. And we're getting bigger hospitals. They keep building us, Liverpool's doubling in size and Campbelltown's doubling in size. But we don't want everybody in the hospitals. We want to keep them in the community. So we're building a patient-centred integrated healthcare hub, and in the next iteration, it's called My Care Partners, and it's the medical neighbourhood. And we're really wanting to reduce preventable hospitalisations. And one of the things that's helping with that is having the hospital in the home running out of the clinic. We've also got the clinic to work 7 till 7, 7 days a week, and they're only closed on 2 public holidays a year. And the GPs have agreed to that. They love to be able to do that. And we've interestingly had 9 GPs contact us internationally to come and work at this practice. So we're doubling the size of it as soon as we can. The model works really well. There's lots to learn. So we've integrated really well at a governance level, at an executive level. We have management meetings, clinical reference groups. The clinicians on the ground are now saying that they want to meet with each other a little bit more. So we've now set up some site meetings across disciplines and across services so that they can blend more together as a team. The clients are saying that they see it quite seamless. They don't know that they're seeing a Karitani service and then a different organisation GP. The clinical records, we're moving towards an integration. These are some of the quotes that we got out of our research, and this is a really typical thing for us. Most of the people in Oran Park are moving into Oran Park. It is a really easy, affordable, lovely location that's still only 40 minutes from the city. There's 3 major arterial ways to get in and out. So we're finding the ways that people are enjoying the service and continuing to build that. So they can go online to book the GP, so we want to go online for them to be able to book every other service in the building as well. And one of the most important things that we see is that they tend to think that the GPs are really accommodating and taking the time to listen to them and learn about what is wrong with them, because they're often taking new histories, 350 new patients a month. They need to learn about a lot of new patients all of the time. Some of the reasons Oran Park has been a success is that it's been a joint venture from the beginning. So the LHD and the PHN, we work exceptionally close together. Primary and community health, LHD, which is where I work, and the PHN are actually in the same building, just on different floors. We meet each other more than we meet with our local health district partners. It's a very detailed shared vision and commitment, and that is met with every partner who's in the service meets monthly to make sure that everything's on the same page, and that's delivery partners and funding partners as well as interested parties. So we all meet. A tested and trusted governance structure is really important, and we were lucky enough to be able to develop that before we set up the program. Contract arrangements, sometimes you have to remind people that when there is a contract in place to do this sort of stuff. That's been really helpful for us, and clinician engagement. The contracts really help when you want to play with servers in a GP practice. They get a little bit nervous about it, but we're all on the same page. I mentioned earlier, and I'll finish with this, about IT interoperability. So when Health Ones were coming out and they were building the super centres, we'd already started the planning for this one. And so Health One sort of said, well, what can we do in the southwest Sydney? And we found that the biggest issue that we had was the lack of transferable data between the LHD and the GP practices. So the PHN, in the way that we share all of our responsibility in this space, they've developed the IRAD, which was the Integrated Real-Time Activity Data, where they've developed a system through DB Motion where they can corral all of the doctor's records into one point. So if you go to practice A and then you go to practice B as a patient, they can see, if those practices are linked to IRAD, they can see those records from both practices. So patients sign into that. It's been picked up really, really, really well. The patients actually think it's quite good, and we've got some areas here where, you know, you've got practices that are open Monday to Friday and other practices that are open on the weekend. We sign both practices up. The GPs can see patients that have gone into both practices. The Health One side of that is we are developing the LHD's records to go to a single point, and then we're joining those 2 points so that we will have a real-time contemporaneous record that can be opened by the GPs or opened by the practice to be able to see exactly who's done what and where, and then we'll move towards shared care planning. So no one can change it, but they can both see exactly what has happened for their clients. And Oran Park has given us the test bed to be able to trial this, which has been working fantastically so far. So we're nearly there. And that is me. Thank you very much.